Hey everyone, my name is Sibin. I am a pharmacist by training. Can psilocybin mushrooms or magic mushrooms help with anorexia? Recently, a study was published in Nature magazine investigating psilocybin for the treatment of anorexia. A group of researchers from UC San Diego conducted an open-label study with 10 adult females between the ages of 18 and 40. They each received one dose of psilocybin. Each of those doses were 25 milligrams of psilocybin, and these are the same doses that were used in the depression trials. All of the patients were treated in a clinical setting with a trained therapist, with each of the individual sessions lasting several hours because of the psychedelic trip. Now, as with all phase 1 studies, this was primarily done to assess safety, tolerability, and feasibility of a potentially larger study. And importantly, there were no significant changes in their vital signs or their ECG, and all of the adverse events were mild and transient in nature. Now, in terms of efficacy, the participants were assessed using an eating disorder examination at baseline, at 1 month follow-up, and then 3 month follow-up. Now, if we take a look at the table, we can see that the weight concerns decreased significantly from baseline at the 1 month and the 3 month mark, which we know because of the p-value. When a p-value is less than 0.05, it's considered statistically significant. Shape concerns also decreased at the 1 month mark, but was not significant at the 3 month mark. Now, of the 10 participants in the trial, 4 had demonstrated clinically significant changes in their eating disorder pathology, but the changes of BMI were variable and not significant, with no correlation between outcomes and weight status. However, when we take a look at the patient's experiences and the qualitative responses, that's when things become a little interesting. 90% endorsed feeling more positive about life endeavors, and 80% endorsed the experience as one of the top most meaningful experiences of their life. 70% reported experiencing a shift in personal identity and overall quality of life. 90% reported that one dose is not enough. According to one of the patients, psilocybin altered how she felt about her body almost independently. It was like a gift, altering my perception in a way that I'm not sure I could have done on my own. Now, that kind of breakthrough in how a patient thinks is not a typical sight that you see with standard anorexia treatments. Cognitive behavioral therapists that conduct CBT can sometimes help normalize eating behavior, but people often relapse in triggering situations or stressful situations. Now, while the results are impressive, the study does have a number of limitations. It was open label, there was no placebo arm, there was only 10 patients, all of them were female, and 9 out of the 10 were white. So of course there is a lack of diversity and a lack of a robust population. So this isn't the perfect study by any means. But in my perspective, this trial definitely warrants a larger study, and it's going to be exciting to see what potential trials in the future hold. Thank you very much. See you in the next video. Peace.